I'd love to hear from you, Nima, maybe whatever you're willing or able to share about your biggest wins and successes both at the individual patient level and maybe also at the client level. Like, talk to us about some of the big wins.
Yeah, I mean, we have successfully reinvented at national scale the payment model for wound care and demonstrated that under a value-based paradigm, patients are able to get higher quality, cost-effective care. And that has been a major, lift, because when we started, we knew, I shared, I was at whether, in the streets of Detroit and rural Mississippi, I knew and I saw what the perverse incentive structure was doing and what kind of behavior was being generated long before the New York Times ever heard of a skin substitute or wrote an article about it, or CMS realized what the problem was. Back in 2022, it was really hard to convince people that wound care was a growing issue and a problem, right? And some people were asking the questions, even though they worked in medical roles at plans and provider organization, what's a wound? What is this thing? Why do I even need to worry about this, right? Some of them it was shocking to me, right? And so I look at our greatest victory as having brought early awareness to this issue and built a solution that once the problem really started to go hockey sticking, that there was an alternative available for health plans and providers, and that we anticipated that. I think that's been our greatest win broadly. On a patient level, I celebrate everything that our distinguished nurses and providers do. It is really hard work. It is not the kind of thing you talk about at a cocktail party. We're dealing with odorous wounds, rotting flesh. There are maggots in some of these wounds. This is not pretty, but this is for the patients who have these wounds and their families. This is really life altering. And there are people out there who are certified, who have dedicated their career. And I'm proud to be one of the organizations that has aggregated the very best of them and aligned them to this problem in a payment model where they get to do what's right for the patient. And I know you both as providers can appreciate this. There are providers being pushed to do certain therapies that they don't agree with, right? And that's also problematic because there are good providers out there. They deserve to be under an incentive structure where they can practice good medical care and exercise appropriate clinical judgment without having a target for how much skin substitute they have to do, what skin substitute product with juicy reimbursement they have to use, and how many debridements they have to do. And unfortunately, that is still the vast majority of wound care companies in this country.